Hi everyone, how are we all doing? So today I'm going to talk a little bit about high risk pregnancies and why it's important to apply a holistic approach to achieving a healthy pregnancy. Now, first of all, I want everyone to know that I am not a medical doctor, but I am a wellness coach. And what I do is to help people, I work with people using diet and certain healthy lifestyle practices in reversing certain health conditions or challenges that people are experiencing. And I've had very good results for the past 5 years that I've been doing this. Now, like I said in my previous videos, my doctor said my pregnancy was high risk. And what made it high risk was, one, my age. So I was 40 going to 41, and when you look at the research, a lot of women between the ages of 35 and above usually are known to have a high risk pregnancy. And the reason for that is because women in this age category are usually predisposed to certain health conditions, same for their babies. And some of the health conditions are like HELP or preeclampsia. Also, you find that, if proper care is not given to this kind of women, they can have a very complicated pregnancy that can also lead to the death of the mother and the baby. Now, the next thing that made my pregnancy high risk was that I had fibroids located in my uterus. And it wasn't just small fibroids, I had massive fibroids where my baby implanted. And so it became a very complicated pregnancy because the doctor said if the baby even survived, as the pregnancy progressed, it could, my uterus could rupture if there were contractions or even labor. So given this condition, I had to look at, discuss closely with my doctor what would have been, the best thing to help to manage these conditions and we achieving a healthy pregnancy and childbirth. And two things my doctor wanted to prescribe was, one was steroids. Now, the steroids was to help the heart of the baby, to strengthen the heart of the baby, which would also enable the growth of the baby, and also to give me what they call aspirin. Now, the aspirin was to prevent the onset of health conditions like preeclampsia. Now, it's very important that, when giving a diagnosis, people do their due diligence. Now, when I was told these things, I had to go look into the medication, and from the research I did, I saw that the side effects were not favorable to me. And so I decided, you know what? I need to go into what I do, which is looking into a holistic therapy for this condition. And this is where, I want to, really get the attention of people. When you have a diagnosis, it's very important that you understand the condition, you understand that medical condition, because when you understand the medical condition, you're able to really understand what is the best treatment for that condition. So to go about the holistic approach in ensuring that I had a healthy pregnancy, I had to start reading up and researching on things that could cause certain conditions in women that are from the ages of 35 and above. So one of the conditions, of course, which is very common, is preeclampsia, and that was one of my major focus. So I looked at, okay, what are the things that can cause it? And when you just Google causes of preeclampsia, you see a long list of things, so things like high blood pressure, nutritional factors, genetics, obesity. So there was a long list. And when I saw all of that, then I started looking into the holistic approach, the suitable holistic approach for this condition. And one of the things I saw was diet, having certain healthy lifestyle practices. And that is why I really went headlong into the holistic approach. Now, the same applied for fibroids. Now, fibroids is something that I'm very familiar with, because if any of you has been following my posts from when I started on Instagram, I talked about how I suffered PCOS. This was a condition that I was able to manage and even reverse by making certain lifestyle changes and diet changes. And again, it made me understand that, I'm someone who is predisposed to certain hormonal conditions, because it could be maybe because of the kind of genes I have. And then also looking at the fact that in my family, I have my mom who has had fibroids. I think just one of my sisters has fibroids, but it's not so severe. So having that knowledge, I knew that this is something that is hereditary. And also, again, knowing that I had a hormonal issue before, which is PCOS, I knew that, this is something that is normal, can occur at any time. So yes, in the past, I've worked with people who have had fibroids, and one of the things that I've seen that's been very helpful in reducing fibroid growth is not just only a change of diet, but also making use of certain herbal therapies. And of course, when you are pregnant, it becomes a very dicey situation. You can't just make use of herbal therapies, because you never know how it's going to affect the growth of the baby. And so I had to really look into what will be suitable for me to, prevent the growth of the fibroid and also to ensure a healthy pregnancy. And this is where, again, I went into a lot of research. I went into a lot of sessions, even with naturopathic doctors, some of which I stopped working with at some point, because I saw that a lot of the things they told me, I already knew them, and another thing was because God had given me that wisdom, so I was able to know how to really create a therapy that would be very suitable for my pregnancy and ensure, that I had a healthy pregnancy and safe child delivery. So I am going to talk about some of those holistic therapies, because I believe that this will be very helpful to any lady who is facing similar issue.